Well, when I look back now, I realize I had symptoms from when I was a teenager, and they were kind of typical RA symptoms, but they would come and go. So in that, that familiar flaring pattern. So most of the time I was fine. And that went on for decades. And then a few years ago, 14 years ago, after I had a baby, it wasn't fine anymore. It was kind of like a long row of dominoes. I injured a toe, it swelled up, but then the next day it was identical toe on the other foot. And then it went to my knees, and then it went to my shoulders. And I wasn't actually doing anything to injure myself, but I was injured. So I went to a couple of doctors, and I was told there's no disease that does this. There's nothing wrong with you. And my good podiatrist was following me throughout this time, because it started in my feet as far as the swelling at that point. And he started to suspect RA, and he knew a good rheumatologist. So he got me to a different doctor. And meanwhile, I tracked down my labs and found out, my antibodies, both my antibody tests for RA were high. So I started trying to learn about RA and trying to figure out what that was. And my good rheumatologist got me on methotrexate injections and a biologic right away. She drew a little picture, and she said, "This is what I learned at ACR." And that's the first time I heard ACR. And she explained to me how the TNF inhibitor would work. And after a couple of years, I was still on that TNF inhibitor. I was taking, a doubly frequent dose, but my disease was still progressing. And I finally decided, I was watching commercials, I think, on TV for another medication. And I thought, there's got to be something else. And I kept saying, when will I be better? And she would say, soon you'll be running on the beach. Most people get better. And, the more things just didn't work the way she thought they would, the more I researched and I started trying to find things out. So within a couple of years, I was ready to change medications. In order to do that, unfortunately, I had to change rheumatologists, because that at the time was her only DMARD that she was using. That was her setup. So I started interacting with other patients online, hearing their stories during those years. This is about 2008. And then I started realizing there's just so many disconnects between what the rheumatologists are saying, or what the commercials are saying, and what the medical websites are saying, and what the patients are experiencing. So I started reading medical journals, and I said, no one's telling this to the patients. So I started spending all this time on different websites, communicating with patients, trying to help them and help myself. And that's when I decided to build a website. So eventually I built the biggest website on RA for patients online. I wrote a book. I helped found a nonprofit. That's how I met Shannon. So went through a long journey after that with numerous biologics and DMARDs that really didn't make a big difference until finally, actually, it's just been about 6 months now that I've been on my second JAK inhibitor, and it's my first treatment response. So I'm very happy that I have a treatment response. Meanwhile, I had a lot of surgeries. I've had a lot of disability, a lot of progression of my disease into other areas of my body outside the joints. So it's not a cure, but I'm very, very happy to have found a medication now.
So my onset is a little bit different from Kelly's, which, we find is quite common for folks to have, very different parts of their story, and yet other parts are very similar. I had a radical hysterectomy 8 years ago. And within a couple of weeks, I started noticing pain and tightness in my hands. And at first I just thought that it was because, the first couple of weeks I wasn't really on my computer at all. And then as I started to feel a little bit better, I started doing some more work from home and using my computer more. And I just thought that, maybe it was related to that. And then when I saw my primary doctor for a check, he wanted to screen me for rheumatoid disease. And I pushed it off because at that point I had done, some of my own Google searches and had found that it's not uncommon for women in menopause to experience some joint symptoms. So I said, no, I think I just need to maybe take a couple more supplements and make a couple more changes to my diet. And I didn't really know a lot about the disease at all at that point, despite the fact that my grandma had it. I really hadn't learned much. She passed away when I was 9. So, the only things I really remembered about her were, was really how much I loved her, how much she loved me. And I did remember the fact that she had crippled feet. And I knew that that was really a hardship for her. So things progressed for me. And 8 weeks after my surgery, we were on a spring break trip and I could barely walk. I found myself on this spring break trip trying to find a pharmacy so I could, maybe find some kind of supplement or something that would help me. And I have a real vivid memory of waking up one night while we were on that trip and I was cold and I tried to pull up the sheet to cover myself up and I couldn't pull up the sheet. I just physically couldn't do it. So that was probably one of my lowest moments, I think, in terms of, just realizing that something terrible was wrong and I really needed to do something. So as soon as we got home, I contacted my physician and I said, yeah, I think we need to do that blood work. And he ordered all the blood work and he called me at 6:00 on a Friday night. And I think, as most of us know, if your physician's calling you at 6:00 on a Friday night, it's either going to be really, really good news or probably really bad news. And unfortunately, he said that all of my lab levels showed that I was high positive across, everything. And he called in a prescription for prednisone to get me going on some prednisone to help with the inflammation that was going on, and put in a referral to rheumatology. And he said they would be calling me. They had a triage process. He couldn't promise me how long it would be, but I actually had my first visit with my rheumatologist the following Wednesday. In that time span in between, when he very first suggested being tested, I thought, well, even if I do have this, I've seen the commercials, like it'll probably be fine. I'll just go on a medication and I'll be back to, running and doing all the things that I like to do. And, unfortunately, and then after I got the word from him that was my diagnosis, I started digging into more research. And I quickly found Kelly's website, RA Warrior, and it truly was a wealth of information. And I learned from there that my best option was aggressive treatment. Fortunately, when I saw my rheumatologist the next week, she was amazing and she encouraged me to be a very educated patient. So she asked a lot of questions, not only about my symptoms, but about me as a person and my lifestyle, so she would understand what it was that was important to me. I started on injectable methotrexate. She explained that there would be a little bit of a waiting period before starting a biologic, but gave me a list of them and gave me information on several so that I could choose which one I wanted to start first. I started with Remicade at that time. I had a pretty big phobia about needles. So I thought, okay, I'll just do the infusion every 8 weeks. I'm already doing a shot once a week. I don't really want to add a second shot a week to that. And now 8 years later, I've been on multiple medications. I tend to show a response at first to a biologic and then it quickly wanes. So I've been on 7 different biologics and I'm on my second JAK inhibitor. So again, I have that tendency to respond at first, and methotrexate definitely helped me, but after a few years, my liver didn't tolerate it anymore. So I went off of it, tried to go back on it, and it just hasn't worked. So I'm currently on Plaquenil, leflunomide, 5 milligrams of prednisone a day, and Olumiant. And that current combination, it leaves me functional on most days. So I'm able to maintain my job as a principal of a small charter school, do my work for the foundation, but there's still some things that I'm not able to do that I love to do. But I'm fortunate and I'm grateful that I am functional most days.
We'd really enjoy hearing from you about some specifics about what it's been like with both of the JAK inhibitors that you've tried. Maybe something about the how you first noticed the effect, the endurance of the effect? What do you find most changed in your life as you learn about or feel the improvement coming from these medications? Kelly, do you want to start off?
Sure, thank you. That is such a great question. Gets right to the heart of everything we've been talking about. Obviously, taking a pill is easy, but living with RA is not easy. So I'll back up to my first JAK inhibitor. I was very much anticipating the approval of Xeljanz, tofacitinib. At the time, I was actually working with the team at Pfizer, kind of behind the scenes, helping them to launch. And I was also attending ACR, so I was aware of it, years ahead of time. And I raised my hand very quickly to try it. I'd already been through a few biologics. So I was very disappointed when nothing happened. I was still on methotrexate. I think that was kind of dampening my disease from progressing quickly. It kept my CRP down, under 15, but I could still feel my disease, and there were still new symptoms and new ways that it was affecting me. So it didn't work. I think every disease and trial that I did was at least 6 months or a year that we gave it a good chance, and it didn't work. So after that, eventually I couldn't take methotrexate anymore, and I didn't have anything. So several of them I'd had an allergic reaction or, some kind of terrible side effect. So during those years where I had nothing, my CRP would be in the 150s. My SED rate was always elevated. What we say is without the steroid shots that I got so frequently, I could only blink. And so the steroids, I would get the Depomedrol intramuscular every 3 months. And then in between all of my joints, I just rotated between my different orthopedists and on my toes, every joint. I've had every joint. I think I've had maybe over all the years, 100 shots of, different steroids. Wow. So for me, when I say that I had my shots before ACR and then Christmas came and I came home at New Year's and I finally got to start my second JAK, which was the Rinvoq, I thought I'll know right away if it works. And within 2 or 3 weeks, I said, I feel different. So my shots would be starting to wear off. It would be about the time that I would really be having a hard time moving around at all, and I would need to go get a shot. Well, I called my rheumatologist and I said, I have a response. So she sent me to the lab, and my SED rate and CRP were 1. Even with shots, they would only come down to 50. So I really feel like what it did was just like what a shot would do for me, a brand new Depomedrol shot, when I'd get up and move around the next day, go get something done. It's like turning down the volume of my disease symptoms to half, anywhere between 40 and 60% every day. So I still have RA, but I'm really, really happy. I feel like I have my life back, and I only have to take my maintenance dose of 5 milligrams of prednisone.
That's wow, powerful story. Shannon, we're very curious about your story and experience with the JAK inhibitor class.
Well, as I shared earlier, I had been on multiple different biologics, and my response would be, pretty strong at first, and then it would wear off pretty quickly. So I was excited to have the opportunity to try a JAK inhibitor. And the first one that I took was Xeljanz, and I actually had a pretty reasonable response from it. It was the longest response I had on anything to that point, for probably about 1 year and 9 months. And then I got a sinus infection that required me going on an antibiotic. So I went off of it for 3 weeks. I was off. And when I resumed taking it, I certainly knew and realized in that 3 weeks that I was not getting the same kind of response that I had been. But when I went back on it, I was hoping that the response would resume, and unfortunately it did not. Now, in that instance, then I my doctor checked, and instead of just starting a different JAK inhibitor, my insurance company, before I could start Olumiant, required me to go on, I had to have been on 3 out of their list of 4 of TNF inhibitors. So despite the fact that I had already been on 3 different TNF inhibitors, I hadn't been on 3 of their 4. So I had to go on yet another TNF inhibitor, which my rheumatologist and I mean, we knew by this point, I had been on so many of them, it wasn't going to work. But I had to play that game. I had to go on it, which wasted, in essence, probably about another 9 months total, because, you go on it and you have to give it some time to see
Sure.
respond to it or not.
Yes.
So went on it, and then after that failed, I was able to start on Olumiant, and I've actually been on it for 1.5 years now. So I'm getting a good response. I would, just for me personally now, after having that experience of having went off of it to take an antibiotic, I think that would be a serious discussion between my rheumatologist and I about whether or not, what would the risks and benefits be in a future situation of having to take an antibiotic or, experiencing some sort of infection, risk benefit in terms of stopping the therapy for a while. But I've been pleased with the response I've gotten. As I shared earlier, I'm functional, and that's what matters. Occasional flares here and there, but a burst of prednisone tends to usually knock that out pretty quickly.
And that's great. One of the things, just to clarify, Olumiant is the same as baricitinib. I know at one point, Kelly, it sounded like you had to switch rheumatologists. And I'm guessing that there was some, quote, discordance in your perspectives. Would you all like to just say a word about this?
Sure. That first rheumatologist, unfortunately, 14 years ago, that was the one biologic that she prescribed. So even though I loved her as a person, I had to find a new doctor to change medicines, because after 2.5 years of the same thing, I started to figure out maybe something else would work. So I wanted to try something else. So I had to find a new doctor. But in that process, I saw a couple of rheumatologists who did not become my rheumatologist, because on the methotrexate, I didn't look very swollen, especially my hands. And my disease at the time was kind of all over, but it was very focused on my knees, shoulders, feet, and neck. My hands did not get very bad, and certainly didn't have the kind of gross swelling and deformity until later. So with that kind of textbook idea that a lot of rheumatologists have of thinking they're going to see swelling in the hands if the disease is active, I was told, well, you must be in remission. Well, maybe you don't have RA. And that was very frustrating until, I found a rheumatologist who was better educated. And I told her, well, another doctor said, well, you don't look like you have RA. And she said, what does RA look like? Everybody looks different. So yeah, that's been something I became very aware, because I work with other patients, over the last 12 years, became very aware that swelling is something that doctors feel like they can't treat what they can't see. And I've even read studies and polls from across the world, and rheumatologists will look for swelling. They put that as the number one way that they can assess disease activity. But for patients, it's function. And in those studies and the patients that I've worked with and surveys we've done bear that out.
Very eloquent. Shannon, any additional comments?
I can just echo what Kelly has said. In my experience with my disease so far, especially early on, I did not experience a lot of swelling. I've had many of my symptoms in my hands and in my feet, but there's a couple areas on my feet that tend to be the spots that swell. It's only been in the more recent, probably year and a half, that I've experienced more swelling. So if my rheumatologist hadn't listened to me and hadn't believed me, she may have approached things very differently, because when I came in, I didn't appear very swollen. My hands would get very red and they were very painful. but I didn't have that symptom. So I think it's important that rheumatologists pay attention to more than just that.
Thank you very much. Thank you both.
Any other comments from you guys, starting with you, Kelly, in terms of your shared decision-making approaches and oral versus injectable, what you've considered in terms of selecting a JAK inhibitor?
No, I think for patients, the most important thing is that it works. And the biggest barrier is that you can't always see that. The visible signs of how active the disease is can be subtle, especially early on. And we don't want it to get where it's really obvious. That's where we want to stop it. So there has to be good communication and trust.
Good. Thanks, Kelly. Shannon, anything to add?
I would say the same thing. Good communication, trust, and that building of a relationship so that the rheumatologist finds out what's important to the patient in terms of function. I used to run. I'm okay giving that up because I can do other things, but there are other functional things that are very important to me to be able to do. So having those conversations to know what of the functional elements are really important to that patient so that can be one of the measures for focus.
That's great. Thank you. What do you want to tell your doctor and where are you in life with your treatments and happiness with your shared decision making with your obviously you have great doctors now, so but give us your last thoughts.
I would love to say my current rheumatologist is not perfect and she only has the tools she has. She can't cure my disease. I have never felt disbelieved. I think that's number one. I send her patients because she believes in treating, not waiting. So if I see somebody that I know they have RA and they don't have a doctor, I send them to her because I know instead of her saying, well, let's just wait and see this is what happened to me. And it became harder and harder to treat and impossible to get to remission. And even if I had that, now I have progression. So
yeah,
don't
great.
wait. Don't
that's
wait.
Good. Thanks. Shannon?
I would say I would agree with Kelly on, not waiting. I recently had to change rheumatologists because my rheumatologist, who I've had for the first 7 years, was taking a year-long sabbatical. So it's been an interesting process of switching. I can say I walked out of my first meeting with my new rheumatologist surprised that he didn't even ask me what I do for a job. And I thought, wow, that's a pretty important question, I think, to ask in terms of assessing functionality. We've had a second visit since then, and that relationship starts to build. So the second visit, I walked away from feeling much more comfortable. But I fully agree with what Kelly said in terms of being them being willing to listen, be willing to listen. And I'm also an advocate for treatment as early as possible. I'm a mom of 2 girls, and we're watching one very closely right now because she's got some CCP levels that are creeping up, and that's a concern to me. But when we visited a rheumatologist with her, it was more of a, she didn't see my rheumatologist. She had to see one in her area. And we just want that to be taken seriously. Let's make sure we have those conversations that we need to have and listen to the patient. We don't want this. We don't enjoy being in pain. We really would much rather just go back to the lives we had before this, but that's not possible. So, keep working with us and listening to us, and it's much appreciated.
Great. Thank you for those thoughts.